The Symbiose implant and Cristalens have been doubly rewarded by the European Commission, the Seal of Excellence and a grant from the Horizon 2020 program. How does continuous phase differ from bi- and trifocal optics? What is the benefit for patients? On a model eye, we compare a bifocal addition, two additions, trifocal, and two complementary diffractive optics with continuous phase. For each of these four optics, we compare the defocus curves and the images from infinity to 35 centimeters. Two elements constitute an image: the amplitude and the phase. The amplitude gives the contrast always positive. The phase gives the sharpness. The transfer modulation function, MTF, expresses the contrast. Even with a very low contrast, the letters are seen. The MTF cannot therefore express the quality of vision by itself. Optical quality of an implant is expressed by the spread function of a point, the PSF. Using a Fourier transform, this becomes the optical transfer function, OTF. As we see on the curve, this OTF can be positive or negative. The negative part of the discontinuous phase curve is an area of blurred vision for a trifocal implant. We have previously observed that the MTF expressing the contrast is always positive and cannot by itself qualify the vision. In summary, continuous phase, clear image in all circumstances, phase inversion, blurred image. The function of phase transfer, PTF, is in red. The MTF, the contrast, is in green. On the bifocal defocus curve, the phase inversion between the two peaks prevents any intermediate vision. For a trifocal implant, the phase inversion around 60 cm causes blurred vision in this area. On the other hand, the Symbiose's MID for intermediate vision and plus for near vision create a continuous phase that provides clear vision at all distances from 35 to 80 cm without affecting distance vision. With continuous phase, images simulated in amplitude and phase at different reading distances are always sharp. This contrasts with the phase inversion associated with blurred images. The combination of MID and plus implants eliminates any decrease in visual acuity between 0 and 3 diopters. The visual acuity plateau curve is equal to or greater than 0 logmar. Halos and glare are moderate and no longer noted by patients after 3 to 6 months. Plateau curve and excellent visual acuity are found by different authors. What is your feedback on Symbiose implants, Dr. Bouchu? I would describe Symbiose implants as hybrid implants and offerings. These implants allow patients to see very well in intermediate vision. These implants maintain a good predictability in distance vision and an efficiency in near vision. It is necessary to specify to the patient that a little light can help them to see at close range and that there are some photic effects at far range, but the overall vision is of great quality. These implants can be used in cataract surgery as well as in clear lens surgery. Hello everyone! A few words about my experience with the Symbiose implant. This implant has a very good refractive predictability. Most of the 10 patients that I operated on had 10/10 of Parino, 2 without correction, both far and near, so their vision was quite satisfactory. And I also insist on the intermediate vision which, out of the 10 or so cases operated on, oscillates between Parino 2 for the best and Parino 5 for one case. Most of them are on Parino 3. As far as tolerance of the implant is concerned, it is very well tolerated. With halos, of course, which exists in some cases, but which are not in the foreground. Finally, the binocular defocus curve is good for all patients and even exceptional in 2 cases, with a curve completely in plateau with a vision of 10/10 almost all the distances. All in all, a last generation implant that gives complete satisfaction given its optical qualities. I thank you for your help. Artis Symbiose implants are part of my therapeutic arsenal for refractive surgery, especially for hyperopic and presbyopic patients. Beyond the age of 50, I suggest it systematically for refractive surgery and there is no other alternative, because it is an implant that gives excellent results for distant vision and for near vision intermediate. I've had almost no complaints about the series of my patients. We have done about 20 since December until now. Following the outbreak of COVID-19, several colleagues in different countries have noted an increase in requests for vision surgery. The fogging of glasses caused by wearing a mask is one of the reasons mentioned. Tanguy Raffray tells us about the evaluation of Symbiose done in Vans. With a 24-month follow-up, we have operated on 40 patients bilaterally, combining PLUS and MID, for a total of 80 implants. Initially with spherical implants, then with toric implants when they become available on the market, allowing for optimal calculation and correction of astigmatism. This was made possible by the laboratory's calculation platform and the variant system, which allowed us to precisely adjust the axis under the operating microscope, thus optimizing the refractive results. My colleagues and I were struck by the first results, the almost immediate adaptation and the ease of reading right from the first implant. We always start with the PLUS. Then, by the ease of use at different distances up close and in between. The studies at Salzburg Reading Desk are the best illustration of this. The Salzburg Reading Desk is composed of 2 screens, a control screen and a reading screen. The reading screen projects random text that can be varied in size, contrast and luminance. The control screen itself measures simultaneously the reading speed of a random sentence expressed in words per minute, the corresponding visual acuity which varies with the reading distance, the contrast which can be varied, and the precise distance of the screen. The examiner checks the sentence read by the patient. If necessary, she shows the unread words in the final result. There, it is necessary to bring you closer. We must be at 40 centimeters. I expect to hear from you in a week. The butcher cuts him a very fine escalope. Now we can move back to 60 centimeters. I would be happy to read these lines. The dress that the little girl is wearing is pretty. We'll move back to 80 centimeters. She's reading a novel that her friend gave her. Artis toric hydrophobic acrylic platform and Symbiose system, PLUS and MID, allow a real refractive tolerance for both the surgeon and the patient, combined with a great ease of adaptation and use. This gives us a good argument to expand the indications of multifocal implants in the interest of our patients.